device.
You know, Mr. Knapp, we just heard testimony that there are varying effects based on the thickness of, let's say, the adult skull versus a child's skull. Isn't that the testimony we've heard here? So you've heard that testimony. You have, you know, there is established by the FCC a specific absorption rate. What do you have to say, now that you've heard this testimony? Do you think that the allowable exposure limit should be higher or lower, or is there, based on what you've heard, is there evidence based on what you've heard that children are more vulnerable than adults, and that might cause the FCC to have to take that into account in constructing your specific absorption rate, which is the exposure limit that you enforce? Mr. Knapp.
The standard that's in place is based on an industry recommended and recommended by other federal agencies accepted standard. It has a margin built in to that standard.
When was that standard developed? When was the baseline for that standard?
It was 1997. There's also been ongoing work. The IEEE has developed a subsequent standard, but it is actually more lenient than our current standard.
Have you, when you say that the industry recommended it, did you just testify to that?
When I said industry, perhaps that was an imprecise word, because these were an IEEE committee that's open to all participants.
Would you explain to people what the IEEE is?
Yeah, it's a professional society that develops standards, the Institute of Electrical and Electronic Engineers. It follows the American National Standards guidelines so that it has to be open to all who want to participate. It includes members of government, users, and manufacturers, and health specialists. So it's developed by a broad range of experts.
And this was established, as you said, in 1997.
Correct.
You've heard testimony here in September of 2008, 11 years later, that indicates that with respect to children, there is a increased likelihood of adverse health effects. Having heard that testimony, how would you choose to proceed with respect to the exposure limits that the FCC sets on a specific absorption rate?
The FCC doesn't have the expertise to evaluate whether the standard is appropriate protection level for the cases that were discussed here.
So where do you get the expertise?
From I think the other federal agencies that are conducting ongoing research and their work with the community.
Thank you, Mr. Knapp.